Thank you for joining us for this presentation, Hygiene and Sanitation for the Homeless Population in San Bernardino and Redlands. Sanitation is a basic right. The human right to sanitation was explicitly recognized as a distinct right by the UN General Assembly in 2015. The right to sanitation entitles everyone to have physical and affordable access to sanitation in all spheres of life that's safe, hygienic, secure, and socially and culturally acceptable, and that provides privacy and ensures dignity. The CDC defines basic sanitation as having access to facilities for safe disposal of human waste, as well as having the ability to maintain hygienic conditions through services such as garbage collection, industrial or hazardous waste management, and wastewater treatment and disposal. The general population has access to basic hygiene and sanitation services in their homes, at work, at school, in commercial and private establishments, and is provided by the city, county, state governments, business owners, and non-profit organizations. The homeless population, on the other hand, is lacking basic access to sanitation. The effects of this deficit for the homeless population is an issue in all of our communities. San Bernardino City has the largest homeless population in the county, followed by Victorville and Redlands. According to the 2018 point-in-time count, there were 2,118 homeless persons in San Bernardino County, which is an increase of 13.5% from the 2017 count. In San Bernardino City, a total of 646 homeless adults and children were counted, and 333 of them were unsheltered. In Redlands, a total of 143 homeless persons were counted, with 136 persons unsheltered. This means 95% of the homeless population in Redlands were unsheltered, which likely increases the risks of poor hygiene and sanitation. The Network for Public Health Law reported that in 2017, Los Angeles Skid Row was noted to have 9 public toilets available for 1,777 adults unsheltered overnight, in comparison to the nation's High Commission for Refugee Standards for long-term refugee camps, which would require 80 toilets for that number. Unfortunately, the skewed perspective of America is that we are more advanced and civilized. However, we deface the people that make up the homeless population, treating them as invisible and, in essence, increasing the level of inequity. Public facilities typically are not open 24 hours a day and are often locked, vandalized, or guarded by security. If living in a shelter, time is limited for the shower and the restroom. If occupying an encampment or living outside, there are limitations to an individual's access to running water. Without running water, showers, hand washing, and clean laundry are not an option. Without access to a toilet, the homeless population is forced to urinate and defecate outside, thereby endangering themselves and others. In recent years, there have been a multi-state outbreak of hepatitis A, a viral liver disease transmitted through the fecal-oral route. For example, ingestion of contaminated food and water, or through direct contact with an infectious person. The results of such lack of sanitation reflects upon a broken legislative infrastructure and injustice of unavailable and inaccessible hygiene and sanitation facilities for the ever-increasing homeless population. The California Department of Health, as of 2018, has reported a slowing down or demobilization of the outbreak due to increased preventative measures of vaccinating at-risk population. However, in 2017, San Diego, Santa Cruz, and Los Angeles were all heavily impacted. San Bernardino County reported 12 hepatitis A cases, however, only one was related to the San Diego outbreak. Additionally, unsanitary conditions increase vulnerability for not only hepatitis A, but meningitis, staphylococcus, and lice and other infectious conditions. Our ultimate goal is to increase access and availability of essential hygiene and sanitation services to the homeless population in the cities of San Bernardino and Redlands. Our long-term goal is to increase partnerships with organizations in the development of diverse, portable, and sustainable essential hygiene and sanitation services for the homeless population in these two cities, San Bernardino and Redlands. Partnerships are critical. There are many organizations in San Bernardino City and Redlands that provide various services to the homeless. However, although places such as Central City Lutheran Mission, Mary's Mercy Center, and Visionary Homes in San Bernardino City offer free showers, the availability of easy access shower facilities are in severe shortage. In Redlands, there is a nonprofit organization called Refresh and Renew that offers free showers to the homeless population using mobile shower units. Mobile shower units have been successfully implemented in other cities and have the advantage of reaching homeless persons in different locations. There are 36 and 49 churches in Redlands and the city of San Bernardino, respectively, whom we can potentially form a partnership in providing secure parking spaces and water and sewer access for mobile sanitary stations. Many of the churches are already providing services to the homeless, which makes forming long-term partnerships easier. Loma Linda University has a volunteer student-run street medicine group that provides medical services to homeless population in the city of San Bernardino. Collaborating with this group will attract more of the homeless population and provide more complete hygiene and sanitation services. Since public libraries are one of the places homeless persons spend their time, 4 public libraries in San Bernardino and 1 public library in Redlands can help in disseminating information about the locations and times of free showers. A partnership can be formed with local hotels in assembling hygiene kits as well. Diverse initiatives such as Lava May and Refresh Spot in California and Urban Rest Stop in Seattle, Washington are just a few of the radical hospitality which exemplify that such a simple gesture of consistent access to a shower, hand washing, restroom, and laundry facilities are empowering tools of self-confidence for the diverse needs of the population that deserves basic hygiene and should be prioritized. Public restrooms can be difficult to find. There are 36 public parks in the city of San Bernardino and 14 in Redlands, but not all of them have open public restrooms, and those that do have limited hours. Starbucks stores have an open restroom policy, and everyone can use their restrooms without making a purchase. There are 7 Starbucks located in the city of San Bernardino and 7 in Redlands. Our short-term program goal is to disseminate information about available essential hygiene sanitation services to the homeless population in the cities of San Bernardino and Redlands. To that end, by May 1st, 2019, we will distribute 500 flyers with maps and schedules to the available hygiene and sanitation services to the homeless population across these 2 cities. And by July 1st, 2019, We will build partnerships with at least 5 organizations to bring more hygiene and sanitation stations to the area, including mobile hygiene programs like Lava May. According to the United Nations High Commission for Refugees, 1 shower per 50 persons and 1 toilet for every 20 persons is recommended in a refugee camp. Thus, our impact objectives are the following. San Bernardino will open facilities with at least 10 public showers, and Redlands will open facilities with at least 4 public showers to help meet the needs of the unsheltered homeless populations by January 2020. San Bernardino and Redlands will increase their available 24-hour public restroom facilities by 25 toilets by January 1st, 2020. Our outcome objectives are ambitious. Hepatitis A cases in the homeless population will be reduced to less than 4 cases per year by 2021. And reports of public urination and defecation from the homeless population will be 0 by 2021. Access and availability to essential hygiene and sanitation services for the homeless population in San Bernardino and Redlands is an issue of equity, dignity, compassion, and improved health outcomes. The compounding level of poverty, lack of long-term housing, food insecurities, unemployment, and lack of hygiene and sanitation facilities continues a cyclical pattern of disadvantaged impacting the homeless socially and psychologically. Will you join us in making a difference? Will you join in the goal?